Well, thank you so much, and it's a great pleasure to be here, coming over from Switzerland. Last Sunday, just a week ago, I was sitting on my breakfast table and reading the newspaper, and then my wife Sunday said, "Darling, why are you actually traveling to this meeting to California next week? You promised and you said you're fed up with all these meetings. You have gone to so many meetings, and you said you don't learn anything, and you come back and say, well, it was not worth it." I was a little. And then I said, and that's really what I believe, I am not going to a meeting. I'm going to the first annual reunion meeting of a movement. That's something very different. It's a movement, and that is a completely new approach to patient safety. I think, and I can just share what the previous two speakers have been saying, we know enough, we had enough meetings, and congratulations actually to this country. We do have excellent institutions who are close to the best. And they are doing just what Mark has been saying now, implementing these three things: leadership, culture, and I would say culture, and good processes. And I would just there adding something which I observe when looking at these best of the best in the class. And that is joy at work. Gratitude to be able to work in one of these institutions where you feel and believe that quality and value comes first. So I think all of that exists. But the problem is, we were and still are not able to scale up, to bring that to from one community to the next community, to the third community, and to make that a movement. The reason I'm here, and the reason why the global community is looking at what you're doing here, is because we are going a new pathway. We are not interested in new knowledge. We are not interested in good intentions, but we are interested in good intentions and make them happen. And that's the interesting part of it, and let's see whether that works. I mean, other organizations have done that, and glad to say that probably the best example is the Clinton Foundation, where they really found a way to get good intentions to be measured and to be implemented. And that's the example where I think you're very special. This movement is young. It's not sure that we will succeed, that you will succeed. And it needs really the effort, the commitment of all of you to make it happen. I think it could happen what, this wonderful picture of the flap of a butterfly suddenly starts getting something, and this ends up with a big storm. Eventually this happens, eventually it doesn't. But the reason why the World Health Organization, other countries are looking at what's happening here. Is this a new model of bottom-up, top-down approach, commitment that will really make things different? In the last year, we tried, with the help of Joe and his team, to bring that kind of thinking and spirit over to other parts. There have been discussions between the patient safety movement here and the newly founded European Patient Safety Foundation. The chairman of it, Hugo van Aken will be speaking right after it. You will see they're doing great things in Europe, and I think we all can learn, mutually learn, and eventually export this model to other parts of the world. We have been this year too, traveling from the US a little more south over the Atlantic to Africa, to Gabon, a country most of you will not even know where it is, but all of you will know the Albert Schweitzer Hospital. And the Albert Schweitzer Hospital is in Gabon, in Lambaréné, and the hospital just became 100 years old. The president of Gabon reunited a whole group of people and said, let's do something. And let's start with some kind of a movement. And whether you believe or not, this movement, and I don't know whether it's a coincidence, I had no saying in it, is called Zero Preventable Deaths in Africa. And the next meeting of this group will be in April of this year, where next week, this Thursday, I will be talking with the people in Gabon at WHO what will be the program for next year. But I don't want to leave that issue without saying it says zero preventable deaths. And then there is a second underline, and I think it is lovely, and you could copy it again. It says a systemic roadmap from dream to reality. A systemic roadmap from dream to reality. And that's what they want to do. I am very much looking forward, how can we learn from what's going on here? Not in content, but in process, and how to build that movement. How can we do that in Europe, and how can we do that in Africa? And hopefully, in a couple of years, we can say there is a method of best practice how to do that. Let me come to the second point of what I want to say this morning, and that is the big global concern. Imagine your mother-in-law, and we have been talking about that yesterday. Your child is in surgery in a hospital. Everything goes perfectly well. He or she attracts a pneumonia, dies of a pneumonia because it's a multi-resistant germ. This is happening all the time. And one could actually change this story around and say, caregivers in the past made mistakes, were not up to best practice standards. They harmed their patients, but at the same time, unfortunately, they did something that they continued to harm other patients, take other caregivers the instrument, and bring us back to the level of medicine we had in the pre-antibiotic period. We have been talking about that now for, I must say, 2 decades almost. WHO, under the leadership of Sir Lehman, I don't know even whether he is already in the room, has published a great book on the antimicrobial resistance in 2012 with actions in it, just to implement them. All the academies of medical sciences, never happened before. All the academies of science worldwide decided last year, let's make a call for action. We need to act on this. And unfortunately, too little happens. Too little happens, and we need to work on that. My suggestion, my proposal for you is, why not use this new instrument we are creating here to tackle this problem particularly, and that everyone who is making a commitment, whether it is related to infectious diseases or not, who cares, has a compulsory point saying, I have done everything which is needed to comply with the regulations to make antibiotic use safe and appropriate. And I think, and measure that, and so that at the end, we would have great outcomes in all kinds of areas, plus this outcome when it comes to antimicrobial resistance. I think that could be done, and you would then, again, be in a leadership position for something which everybody of us is really concerned about. Next Sunday, be sure, my wife will ask me, was it worse? It's up to you, it's up to us in the next 2 days that I can say with whole conviction, yes, it was worse to do it because we made a step, and I repeat this sentence I like, a step on the systemic roadmap from a dream to reality. Thank you.